Don't forget to wear your rubbers. This was a line in a reading program in grade school for students way back when. Like, way back when we had paper books. And obviously she was referring to ring shoes. So then fast forward to somewhere around 1980. And I was at my friend Doug's house, actually his apartment, having cocktails with his parents before going out to the theater. And out of the blue, Doug's mother exclaimed that she had some sex news for us. And she was proceeding to tell us, us gay guys, that she'd read about some type of gay disease that might be spreading through sex. So she said the boys better start wearing rubbers. And for any of you out there that are from a Jewish home, if you don't do what Mama says, you're in for a lot of trouble. So then we go to around 1989. Then I was living in the Central West End, and it was a weekday morning. I was having breakfast at the Majestic. You remember the Majestic? Janice slinging your flatware on the table saying, "What do you want?" And the place wasn't too crowded. And I noticed, tonight we'll just call him John. He was tall, dark hair, trim, bearded. He had movie star looks. And I'd always had a schoolgirl's crush on him, but I thought he was too good for me. And I was really too shy to ever talk to him. But that day, he didn't seem like the John I knew in the bars. He was very thin. He was sunken-faced, he was hollow-eyed, and he wasn't holding his coffee cup still. It was splashing all over his tweed jacket. And then I realized John was sick. John had the AIDS virus. He was in very bad shape. And I thought, wow, he's just like the boys that were in the hospital beds that I visited in Barnes. And I was really taken back that my fantasy man was sick with the AIDS virus. So the rest of the day was spent doing math. John was sick, and I had played with John's ex-boyfriend. What do you do in this case? So I could find it in my BFF. Back then they were just called good friends. And my friend suggested we go to the St. Louis Health Clinic, which at that time was down on South Grand, way back that way. And at that time, my friend confided to me on his HIV status. And even though I was among the first group of volunteers at EFA, and once again, even though I'd been in many hospital room, when they still called this the disease that only hit gay men on the East Coast or the West Coast, and they called it GRID. And I also had stopped going to funerals, and I sent huge flower arrangements instead. And the first thing I did in the morning was read the obituaries. This disease called AIDS was right here in St. Louis. And then it killed my friends and the friends of my friends. People that I always remember seeing each Saturday night, right in the same spot in the bar, and then it hit me. They're gone. they're gone and I'm not. God had called them all home and left me here for another day.
I would like for us to take this opportunity and I would like to invite you to a time to remember. This will give you the opportunity this evening to call out names of friends, family, loved ones who have been lost to HIV and AIDS. So at this time, I'd like to invite you to say their names out loud as you feel comfortable.
Leon. Steve. David. Eric.
Byron. Dennis. Tony.
Alan.
David. Harry.
Jacques. Kevin.
Doug. Kevin.
Ralph.
Jeff. Mark. Dale. Gregory. Terry.
Raymond.
Bill Smith. Jim Moran.
You can shed tears that I am gone, or you can smile because I have lived. You can close your eyes and pray that I'll come back, or you can open your eyes and see all I left. Your heart can be empty because you can't see me. Or you can be full of the love we shared. You can turn your back on tomorrow and live yesterday. Or you can be happy for tomorrow because of yesterday. You can remember me and only that I am gone. Or you can cherish my memory and let it live on. You can cry and close your mind, be empty and turn your back. Or you can do what I want you to do. Smile, open your eyes, love, and go on.
Reflect on a number of those and celebrate them for giving us new or renewed energy and hope for our future. In 1983, early in the epidemic, the Center for Disease Control associated HIV transmission with sexual activity, intravenous drug use, and contact with infected blood. Increased understanding of transmission allows for development of prevention methods. Practicing safe sex through condom usage, as well as microbicides and PrEP, have developed effective prevention strategies. In addition, needle exchanges and protocols for screening at blood banks have helped prevent the transmission of HIV. Testing for HIV has been improved with the development of HIV antibody tests, rapid test kits, and now even home testing. The earlier someone learns they have a positive HIV status, the sooner they can get treatment and prevent further infections of partners. Understanding the transmission and prevention developments give us hope.
Brian White was a teenager in the 1980s when he was diagnosed with HIV. He was born with hemophilia and contracted HIV from an infected blood transfusion. When Ryan was diagnosed, the local school board expelled him. Ryan White died in April 1990 after 7 years of advocating about HIV and how those infected with the infection should not be feared. In August 1990, Congress signed the Ryan White Care Act, which created a system that has greatly improved the quality and availability of health care and support services for people living with HIV/AIDS. The Ryan White program is the largest federal program specifically dedicated to providing life-saving care to more than 500,000 people with HIV/AIDS each year. The Ryan White Care Act gives us hope.
After 6 years of watching people die, a new treatment emerged. The drug Remembrance, or AZT, was FDA approved and began to be used in high doses to treat people infected with HIV. AZT slowed HIV replication in patients, but did not stop it entirely, leading to resistance over time. In 1996, treatment options took another step forward with the introduction of protease inhibitors. Combining these drugs with existing HIV/AIDS drugs was called antiretroviral therapy and proved extremely effective in reducing the amount of virus in the body by 99%. Life expectancies were greatly increased. HIV infection was no longer thought of as a death sentence, but a manageable condition. Early the next year, Remembrance was shown to drastically reduce transmission of HIV from mother to child when used during pregnancy and delivery. New protocols led to transmission rates from mother to child being reduced from 1 in 4 to less than 3%. Early drug breakthroughs give us hope.
In July 2006, the first once-a-day single combination pill for the treatment of HIV was approved by the FDA. The Atripla tablet, a fixed-dose combination of 3 medications, was designed to simplify treatment. It was the first tablet that included a complete antiretroviral regimen. Compared to taking dozens of pills a day, taking just 1 pill was a great simplification for people living with HIV/AIDS and increased their chances for successful adherence to treatment. 1 pill a day gives us hope.
Timothy Ray Brown, known as the Berlin patient, is the only person said to have been cured of HIV/AIDS. In 2007, Tim Brown needed a bone marrow transplant due to his leukemia. His doctor, Gerald Hutter, found a donor with a rare cell mutation that makes them resistant to HIV. The transplant not only cured his cancer, but also appeared to have cured his HIV. Timothy Ray Brown has not taken HIV medications yet for the last 5 years and has had no trace of HIV in his body. He says, I have been poked and biopsied from head to toe. Samples have been taken from my spinal fluid, anal mucosa, and any other place you doctors can think of to stick a needle, but no virus has been found anywhere. Timothy Ray Brown and Dr. Hutter, you give us hope.
Too often, individuals affected by HIV/AIDS have been rejected by their families, their loved ones, and their communities. Ignorance, lack of knowledge, fear, and denial have all contributed to the stigma. While still present, stigma has lessened over the years due to the increased education as well as policy changes. Awareness efforts such as AIDS walks in many cities help personalize and put a face on the disease, leading to deeper empathy for those impacted by HIV/AIDS. Public policies which support and protect people living with HIV/AIDS have also reduced stigma. For example, in 2010, Congress lifted the ban on people who are HIV positive traveling into the United States. Public figures such as Magic Johnson have used their celebrity status to help decrease stigma. In 6 months after Magic Johnson revealed his HIV status, the number of people being tested for HIV in New York City increased almost 60%. The reduction of stigma gives us hope.
In 2010, the White House released the National HIV Strategy as the nation's first ever comprehensive and coordinated plan. The strategy's vision states that the United States will become a place where new HIV infections are rare, and when they do occur, every person, regardless of their background, will have unfettered access to high-quality, life-extending care free from stigma and discrimination. The 3 goals of the National HIV/AIDS Strategy are to reduce new HIV infections, increase access to and improve health outcomes for people living with HIV, and reduce HIV-related health disparities. The National HIV Strategy gives us hope.
When people learn that they are infected with HIV and get into effective treatment as soon as possible, this not only prevents them from getting AIDS-related illnesses, but almost eliminates the risk they will pass the virus on to others. People with HIV are 96% likely to pass the virus on if they less likely. People with HIV are 96% less likely to pass the virus on if they faithfully take the antiretroviral medicine. These medicines decrease the amount of HIV virus in the blood, or viral load. A lowered viral load is the single biggest risk factor in the transmission of HIV. Treatment as prevention is a strategy that individuals can use to protect their sexual partner and/or on a larger scale to reduce HIV transmission among population. Treatment as prevention gives us hope.